Hi everyone, my name is Oyinda and I'm excited to present my summer research, which was a review of the transmission risk of HIV through breastfeeding. HIV is a virus that infects CD4 immune cells of humans, also known as helper T cells, and is transmitted through some bodily fluids. As a retrovirus, HIV integrates its viral genome into immune cells as part of its replication life cycle as seen in the image. Globally, 39 million people are living with HIV, and 53% of this population are women and girls. If left untreated, HIV can lead to a spectrum of conditions known as AIDS. AIDS is a late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. Antiretroviral therapy, or ART, is a recommended treatment for people living with HIV. ART is effective in reducing viral load, which is the amount of virus in the blood. Breast milk is a dynamic fluid that provides infants with the necessary nutrition for their first 6 months of life. However, HIV can be transmitted through breast milk either through cell-free virus or cell-associated virus in the immune cells of milk. For mothers living with HIV in high-resource settings, such as Canada and the USA, current recommendations are for exclusive formula feeding for their infants. This is the only method of feeding which has a 0% risk of transmission. However, many people may desire to still breastfeed for a variety of reasons. For example, reasons may include perceptions of mother-infant bonding, cultural norms, avoidance of disclosing HIV status, or a lack of information about the risks of transmission. In low-resource settings, breastfeeding is still recommended due to the high prevalence of infectious and childhood diseases and mortality that milk protects against. The purpose of this literature review was to update the information sheet shown on the screen, which is currently hosted on the Ontario HIV Treatment Network website. I aim to add more high-quality evidence published since 2019. Through searching databases and hand-searching reference lists, I was able to find 5 additional trials. Of these 5 studies, most of them occurred in countries across Africa, and 55,000 mothers were included across all trials. Factors that were associated with a higher risk of vertical transmission during breastfeeding included having a lower CD4 cell count and having a detectable viral load, which were expected. Additionally, I found that fluctuating viral load and CD4 cell count over time were associated with an increased risk of transmission through breastfeeding. Inconsistent ART use was also associated with an increased risk. This included not using ART during pregnancy, the late initiation of ART, which is defined as being less than 8 weeks prior to delivery, or having gaps in treatment. Another interesting risk factor was having subclinical mastitis, which is an asymptomatic inflammation of the mammary gland. One study reported that an increased amount of HIV was associated with subclinical mastitis in mothers living with HIV. The study also found that subclinical mastitis was common among mothers living with HIV, where about 60% had at least one episode and about 30% had at least one severe episode. Overall, the rate of transmission ranged from 0.4 to 1.5% in mothers living with HIV and receiving ART. Looking closer at the cases where vertical transmission did occur, while vertical transmission was more likely where there was no ART during breastfeeding or where viral load was not suppressed, there were still transmissions when viral load was undetectable and ART use was consistent. Limitations of the included studies include the limited generalizability to high-resource settings and how most of the studies did not measure viral load in milk itself. Because of that, we currently don't know how much virus is being passed through the milk when a transmission occurs. Another limitation was that testing of various metrics occurred at fixed and often distant time points, some spanning 3 months. Especially for mothers who had undetectable viral loads, these gaps in the time of testing don't allow us to determine exactly when transmission occurred and if blips or sudden increases in viral load may have contributed to vertical transmission. Future research should focus on quantifying the viral load in breast milk to bridge the gap of the limitations. Additionally, mothers living with HIV should be counseled on the risk of transmission through breastfeeding. Mothers who choose to breastfeed should be frequently monitored and have ongoing support from healthcare providers to ensure optimal outcomes for both infant and mother. Thank you for listening to this presentation. I would like to acknowledge Dr. Lena Sergaides and her lab and the Amgen Scholars Canada program, including Dr. Rula Andropoulos, for the opportunity to conduct this research.